It's a totally preventable disease, and yet the American Cancer Society anticipates more than 51,000 people will die from colorectal cancer this year. Patients are becoming younger and younger.
In fact, Melissa Correa tracked down a Houston woman who was diagnosed in her 20s.
It was a shock for sure, yeah.
Brittany Dotson remembers the red flags.
I was having symptoms of bleeding and pain.
She lived with the symptoms for about a year before seeing a doctor in 2016. She was diagnosed with stage 3 colorectal cancer at 26 years old. After surgeries and therapy at Memorial Hermann, Brittany is now cancer-free and on a mission to raise awareness for annual screenings.
If you have any symptoms, get it checked out. Because it could end up saving your life.
Early detection cures the disease.
Dr. G. Ash Ramesh reminds us that 98% of colon cancer develops from a polyp.
And it takes approximately 5 to 10 years for polyp to become malignant.
Doctors say a colonoscopy is the gold standard for screening, and the American Cancer Society is now recommending that first-time colonoscopies happen at 45 years old instead of 50.
If they don't have a family history of colon cancer, they'll say, I don't have a family history, I don't have any symptoms, I don't need to be screened. That's a myth. The biggest risk factor for colon cancer is being 50 and above.
Which is why testing at least 5 years sooner could make all the difference. Or as Brittany reminds us,
I think the earlier the better, honestly.
And doctors say some lifestyle changes can also reduce your risk of colon cancer. Cut out smoking and alcohol. Also reduce your red meat intake and add more veggies and fruits to your diet. Also, it doesn't hurt to increase your fiber intake. Regular exercise and healthy living at a healthy weight, Ron and Mia, also help to reduce the risk of getting colon cancer. But although the recommended age for colonoscopies dropped, does not mean your insurance necessarily will cover it. So it's one of those things that we have to wait and see. You need to talk to your doctor. There's some at-home stool tests that can also work if you're worried about maybe having this in the future.
I like going the preventative way, doing all those things that you said.
Absolutely.
Eating right, exercising, taking care of ourselves.
Absolutely.
But insurance is important too.
Yes, it is.
Check on that. All right, thank you so much, Melissa Correa. You can read more about the signs you need to look out for on KHOU.com and the KHOU app.